If you're thinking about having a knee replacement, there are some important questions you probably want the answers to.
Hi guys, it's Dr. Adam here. I'm an orthopaedic surgeon. When I speak to people about knee replacements, there are some common questions which keep coming up again and again, and often these create a lot of confusion and anxiety. People often have family or friends who have their own experiences of knee replacements. In this video, I'm going to run through 10 of the most common questions which I get asked in clinic, and I'll give you some evidence-based answers so that when you speak to your surgeon, you're better informed and have a clearer idea of what to expect before, during and after the surgery. We'll start off by talking about the average lifespan of a total knee replacement and how likely you are to be satisfied with the outcome of surgery, which often surprises a lot of people. I'll then explain what you can expect in terms of post-op pain, function and returning to normal day-to-day activities, and some things that you can do to reduce your risk of getting an infection and to speed up your recovery. I'll then go through whether or not you can expect your knee replacement to set off a metal detector at the airport and some important questions that you need to ask your surgeon before going ahead.
As always, this video is for information purposes only, and you should speak to your doctor before making any decisions about your care. So, how long does a knee replacement actually last? In this study published in The Lancet, the authors looked at national registries of joint replacements from around the world, and they combined their results in a meta-analysis. What they found was that 82% of total knee replacements last 25 years, which is pretty good. However, bear in mind that if you are younger and more active, then the risk of needing revision surgery increases significantly. The lifetime risk of needing revision or redo surgery if you have a total hip or knee replacement and are over the age of 70 years was found to be 5%. However, for people younger than 70 years, the lifetime risk increased, and for men under the age of 55, this was as high as 35%. The next question is, how likely are you to be happy with the outcome of knee replacement? The answer to this depends upon lots of factors and which study you read, but as a good ballpark estimate, what I usually tell people is that there are three groups of people. The first group, which is around 80%, are generally satisfied and happy with the outcome of surgery. The next group, around 15%, are generally satisfied, but some aspects of it doesn't quite meet their expectations, for example in terms of pain or stiffness or stability of the knee, but most of this group are still glad that they had the surgery done. However, 5% of people, or around 1 in 20, regret having the surgery done, and they have serious complications, for example chronic intractable pain, infection, medical complications such as blood clots, heart attack or stroke. So altogether, the chance of you being glad that you had the knee replacement done is around 95%. Now that might surprise you, and the most interesting thing is that sometimes the operation goes really well and the x-ray looks perfect, but the patient just still isn't happy, and no one quite knows why this is the case. A 20% chance of being dissatisfied in one way or another is actually quite high, and it's something that's worth bearing in mind when you're making the decision whether or not to go ahead with a knee replacement. If you're finding this video helpful, please do remember to hit subscribe to stay updated for other videos about knee replacements and other health topics. The next question is, how much pain will you be in afterwards? Now, universally, I find people underestimate just how painful a total knee replacement is, especially during the first couple of weeks. The inflammation peaks in the first week, it swells up, it's painful, and you'll need lots of painkillers and to ice the knee afterwards. Usually, after around 2 weeks, the pain starts to get much better, and by 6 weeks, people are back to doing most things that they want to do in terms of gentle day-to-day activities. Between 6% and 10% of patients have moderate to severe pain that continues for at least 3 months post-operatively. Number 4 is recovery, and people ask, what will you be able to do after the surgery? Now, almost always, unless there's a problem during the operation, your surgeon will allow you to fully weight bear. Most people need some additional support for the first week or two, but gradually over the following weeks, you'll be able to wean off your crutches or frame. Lots of people ask me about driving and when it's safe to go back to doing that. Now, it's a really difficult question to give an exact answer to, as it varies from person to person. In my experience, generally by around 6 to 8 weeks, most people can get back to driving, but that really varies a lot depending upon how much pain you're in. You have to be able to control the vehicle and you have to be able to brake and do an emergency stop if you need. And that also depends upon which knee you've had operated. If it's the right leg, which is the braking foot, then you need to be able to slam your foot down onto the brake. So clearly this might take a bit longer. It's also worth just having a chat with your insurance company because some insurance companies may specify when they are or aren't happy for you to drive and whether or not your insurance is valid. So on average, it's 6 to 8 weeks, but you must check with your surgeon and physiotherapy team, and if there's any doubts, just leave it a bit longer until you're completely satisfied that it's safe to go back to driving. After a knee replacement, you can definitely expect to be able to do things such as cycling, swimming, or hiking if you were doing these before surgery, but often it's difficult to do activities such as running or jumping. One of the biggest predictors of how much you'll be able to bend or flex the knee after surgery is what you were able to do pre-operatively before you have the surgery. Now, some people unfortunately do end up with stiff knees and they really struggle to bend them, but there are some exercises you can do, particularly in the first couple of months after surgery, which give you the best chance possible to get a good range of motion that you'll be happy with. The next question is, how will you close my skin? Well, there are generally three main types of skin closure. The first is with skin staples, which are basically small metal clips that work like normal staples and pull the skin edges together. These need to be removed after around 2 weeks when the skin has healed. The second is with non-absorbable stitches, which again need to be taken out. And the third is with some kind of dissolvable stitch that runs under the skin. And sometimes surgeons use steri strips or skin glue over the top of this, or they may leave the ends of the suture outside the wound and these need to be trimmed, but the suture itself is dissolvable. Now on top of the skin, the surgeons will usually put an adhesive dressing of some kind, and the aim of this is really to act as a barrier to help stop the wound from getting infected. Now it's important that you don't keep removing this because it's a clean environment underneath this dressing, and unless it becomes soaked or the surgeon tells you otherwise, leave it on until the 2-week mark when the wound is checked. On top of the adhesive dressing, there's normally a layer of soft padding or wool, followed by a crepe bandage, and most surgeons will be happy for you to remove this after a few days. In terms of getting the wound wet, unless your surgeon tells you otherwise, generally you should keep the wound dry for at least 2 weeks. Now, the outer sticky dressings are usually splash proof, but they're not immersion proof, and if you do have a shower, I usually recommend that you wrap the leg up in something like a plastic bag or just wrapping cling film around the leg multiple times to stop it from getting wet. If it does get wet, it's really important you go back to your nurse or doctor so they can change the dressing because you don't want a damp, soggy dressing next to the wound for the next 2 weeks. So next up, how can you prevent infection after a knee replacement? Now this is a devastating complication and there are some simple things you can do which dramatically reduce your risk of getting an infection. I go through this in a lot more detail in another video, so I won't spend too long on it here, but in essence, some of the key things that you can do are looking after your skin, so avoiding bites, sunburns, taking care of the skin, not putting products which may cause inflammation or irritation of the skin, and also not shaving just before surgery, as this has been shown to increase the risk of infection. It's really important you keep on top of medical conditions, in particular diabetes, and that you stop smoking, as getting these under control will help reduce infection risk. Don't have a steroid injection in the months leading up to surgery, as there's good evidence that injections, certainly within 3 months and possibly up to 6 months before a knee replacement, increases the risk of infection. So next up, what can you do to speed up your recovery after knee replacement? I go through this again in more detail in another video, but some of the top things I'd recommend are firstly, using painkillers regularly and on time. This will really help keep the pain at bay, and it's important to get the painkillers on board soon after the operation, as the local anaesthetic put in during surgery starts to wear off over the following day. The other thing that's really important is icing the knee, cooling it down, which can help reduce inflammation, and engaging with physiotherapy, in particular working on both extension of the knee, so getting it straight, and also range of motion in terms of flexion of the knee. A really common question is, will my knee replacement set off the metal detector at the airport? This study looked at exactly this question, and they looked at 200 people with a variety of different implants in place. About half the implants were detected by the metal detector, but most people said it didn't cause them any significant inconvenience. If you're worried about it, the best thing to do is to take some kind of documentation, for example, a clinic letter or documentation from your doctor confirming that you have an implant in place. People often ask what type of diet they should be having after surgery. Something that's really important to remember is that the body's protein requirement goes up massively as it needs protein to help rebuild those damaged tissues following surgery. It's also important to have a diet rich in antioxidants. And finally, what questions should you be asking your surgeon before surgery? I go through this in more detail in another video, but some specific things you want to be asking are how many knee replacements they do each year. As with most surgical procedures, there's a volume-outcome relationship, and if someone's only doing a few a year, they're more likely to have complications. It's also important to ask what their specific complication rate is, and by this I don't just mean generic national averages, but what the complication rate is for them, and perhaps more importantly for the hospital in which they work. You can also ask them which knee replacement specifically they're planning to use in your knee and what the outcomes are for this. I hope you found that video helpful. Please remember to like and hit subscribe and stay tuned for more videos coming up soon.